My name's Mary Potter. I started off health advocacy probably 20 years ago, and then after retirement I decided to use my own health issues and that of members of the family as a springboard into trying to help make changes in the system. I was going out a door at dusk from well-lit room onto a pavement. I was due to have cataract surgery and I missed a step that was probably an inch high and on my back like a cockroach. So that ended up with a broken arm. I've had terrific treatment and follow-up into a falls prevention program actually, a thorough check-up on my bone density, but the arm didn't heal, so I've been left with a legacy of unhealed, unjoined, broken arm that still aches after 3 years, just due to missing a 1-inch step.
Well, my name is Megan Swan. I'm an occupational therapist, but I'm also a health promotion worker, and I've been involved in the program Stepping On, which is a community-based falls prevention program now for about 20 years. Well, we all fall. As when we're young we fall, and in the middle of our life we fall, but it's just as we get older, when we fall, things happen. We break our legs and we lose our confidence. So as we're getting older, the things that happen to our bodies make us more predisposed to falling.
So as people get older, everything slows down. People's posture and balance deteriorates. The feedback they get from their legs and feet is not as good as it used to be. Their vision is not as good as it used to be. People's balance is not as good.
That's the bad news. The good news is there's lots we can do to prevent falls, and Australia and New Zealand are leading cutting edge in that research, so it's very exciting.
If a patient has significant comorbidities, significant complexities, I would usually refer people to a falls clinic. There's a falls clinic at Mona Vale Hospital which is run by the geriatric service, which is a multi-disciplinary team involving a geriatrician, physios, OTs. I use community-based exercise, strength and balance type exercise programs, the Stepping On program I refer to.
When I had my fall in Melbourne, they referred me back again to the emergency department at our local hospital, and then they sent me to the fracture clinic, and the fracture clinic followed that up with referring me at the local hospital to a falls prevention program. Since then, I attend a local rehab hospital and do the exercises there, and I do a lot at home.
The way I often identify people to talk to is I actually watch them get up and walk to the office from the waiting room, and that's quite frightening sometimes. I think it's predominantly an issue of the ageing. I mean, everybody falls over. Certainly people who are on medications that slow down their reactions, people affected by drugs and alcohol, we see not uncommonly.
Well, falls are never a one-off thing. There's always lots of things that happen to create a fall. I'll just go through some of the areas that you can do. I can start off with balance. A lot of people tell me that they get wobbly as they get older, they lose their balance. And that is something that happens because we're not testing our balance. We kind of start noticing it as we get older, and balance is very important to keeping ourselves upright. But the good news is there's lots you can do about balance. You can increase your balance. Strength. Our legs lose quite a bit of strength as we get older. And we all know that our legs aren't the same as they were when they were 20s, and there's quite a bit you can do with your strength. Our eyes aren't the greatest. There's things that happen to our eyes. Macular degeneration, glaucoma, cataracts, there's lots of things that can happen, so we need to keep abreast of our eyes, because without our eyes we fall over. We just have to stand on one leg and close our eyes and we fall over, so we've got to get our eyes checked. Medication. As we get older we usually get on more medication than when we were younger, and medication just doesn't mean over the counter. It can be vitamins, it can be patches, it can be herbal medicines, and there is great correlation between being on 4 or more medications and falling, or also being on sleeping tablets and falling, and we talk about that in stepping on. Shoes, that's another area. A lot of people, they don't call them slippers for nothing. You slip on your slippers, and you need to be able to get that great heel-toe walking that gets you upright and scanning ahead, and you can't do that with slippers or with shoes that haven't got the 4 safe features of a good shoe, which is fit, sole, heel and support are the 4 features of a good shoe. It's really important to have shoes that hug your feet so that you can do the heel toe, but you also need a good grip on the sole, just like you have good tyres on your car. We also talk about you've got to feel confident about the way you're walking and going up and down steps and stairs, so public transport's really important. A lot of people get socially isolated and they don't go out on public transport, so we talk about the best way of getting on and off buses and trains and escalators. You have to somehow get some calcium in your diet, and you need more calcium, 4 servings a day, which is quite a lot. And you need vitamin D. We do need 10 minutes a day in summer and at least 20 minutes a day in winter.
Public transport can be difficult. Catching a train, there's frequently a large gap between the platform and the carriage, or not only a large gap, but there's quite a large step, so you have the gap plus the step, and that can be quite difficult. My husband and I are natural clutterers, and so it's a matter of not leaving things on the floor and also not having rugs because it's very easy to stumble over. Now I use a stick, and I have changed the rubber tip on the end of my stick, which is lovely. It's spring-loaded, so that eases my arm, but it doesn't slip on wet pavement or a wet floor, whereas I have found ordinary walking sticks, the tip can slip. So I do need to look out constantly for the pavements that I'm walking on. And in the dark, I walk very cautiously and try to have a torch, something that will give me some illumination, or if there's no opportunity to turn on a light. I've done follow-up exercises on an ongoing basis to try to strengthen my legs, so that if I get wobbly, I've got the ability to counteract the wobbles, and instead of falling or going against a wall, I'm able to correct any stumble. For me, it's vigilance the whole time. And again, I'm motivated. I don't want another fall. I've had a lot of, I've had hip surgery. I certainly don't want to fall and break my hip, because that is another painful procedure and loss of independence. And yeah, I think most of us fight as hard as we can to maintain our independence.
I generally advise people to not give up doing what they're doing. So if you don't use it, you lose it. So people should continue their walking and do all of the things they normally do.